we have here Phoebe. He is the person that I mentioned to you came back because last time she was here, is it okay I mention your leg?
Yeah, totally.
That she had the non-healing ulcer on her leg.
Yes.
You know, right?
Yes. Yeah. I developed a open wound, a venous leg ulcer on the inside of my right leg at the ankle. And I went to a wound clinic every week from January every week until toward the end of August, and it never healed. And I had to wear like a cast on my leg. It was like a soft cast, so I couldn't go
It's called an
swimming.
Una boot.
Yeah, Una boot. So I
Right.
couldn't go swimming or hiking or, things that I like to do. And they told me at the wound clinic I should be prepared for it never to heal. And it also hurt quite a bit.
Painful, yeah.
Yeah, so I had to
Yeah.
take things like Advil that I'm not supposed to take occasionally because it hurts so much. And so I came here September 1st, and I was going to stay for just 1 month, but Dr. Fuhrman suggested 2 months, which was totally right. And 3 days before I left at the end of October, it was completely healed.
That's a miracle. And I bet you have, visual proof if somebody really needed to see that leg.
Yeah.
Yeah, it's like that's the exciting part. We have so many miracles that people hear, and because the body has this miraculous self-healing powers, when we're giving it all the right tools, and we also use soft wave on your leg too, right?
Yeah.
Soft wave treatment to help circulation, improve circulation. There, it wasn't just a diet, you know what I mean? And we also were able to change her dressings and change the wound and change the Una boot. So she had wound care, she had treatments, and she had everything she needed here. So it was good.
Yeah.
What's the youngest guest you ever had, and what's the oldest guest you ever had?
My mother just left. She's 97.
Oh, why didn't you keep her? We want to meet her.
She had to go to therapy because she fell and broke her arm about 2 months ago. So but her arm's all better. It healed up so good. But so she had to leave to go to therapy for her arm.
But did you say she was 97?
Yeah, 97.
That's amazing. And she plays cards with the patients, right? Or those guests?
Yes, she does. She well, at our retreat, we came to this location from our other location. We're going when the retreat was close to her house, and which it will be again, we're going to shift back. She would come there almost every, a few nights a week and lead games and cards at night after dinner. And now she doesn't do that. Now she comes for lunch mostly, not for dinner and doing the games, but she did do that a lot. But what's interesting is that when my mother had her, my mother's husband passed away, not, my stepfather, then she came and we moved her out here about a mile from the retreat, and she started eating the meals here. And when she got here, her kidney function wasn't that good. She had a creatinine was elevated, and she was on eating 3 blood pressure medications to control her blood pressure. Wasn't that bad, wasn't that good. She was still like 90 years old. Wasn't bad, wasn't terrible health, but kind of frail and, worried about her. But over the years she's been here, her kidney function went back to normal, and she doesn't need blood pressure medication anymore. So even it healed at the age of 90 to 90. She's healthier now at 97 than she was when she got here at 90. You follow me? She was eating healthier than most people, but not as healthy as she does now that she's right by me,
Matt, I hope next time you come on for any reason we get to meet her.